for the IV cannulation, it's still the same thing we do at back home. Before any procedure, like I mentioned, when you must have gathered all your equipment for the IV cannulation, you need to gather all your equipment. You need your tonic. I usually use it step by step. I usually in my head I go through it step by step in my head in terms of the procedure I want to do, what I need to have before going into the patient's bay. So not because sometimes if you forget anything, it doesn't look good stopping the patient in middle way and then going back or rushing back to the treatment room to get all this stuff. So in my head, before any procedure, I go through the step in my head and then know what I need to take before going. So first of all, when you need, let's say for the IV cannulation, you want to do a cannulate a patient, try to get the first thing is the patient's details, the name and the NHS number. When you go to the treatment room, that's where they keep all the equipment. When you go to the treatment room, you go through the steps in your head. So the first step is what do I need for IV cannulation? The first thing is you first of all clean. So you need your alcohol prep, that's the clean, the wipes. Then your tourniquet. So you need your tourniquet in. Then so what do I do in terms of what do I need to take the blood with? So you have some trust use the butterfly. The butterfly needle, which I've just displayed on my screen. So there is a butterfly needle. There's also this short needle that some phlebotomists, that's what they usually use to collect the blood. It's a very short needle, but why I don't usually like that needle is just because it's bigger compared to this butterfly. The butterfly needles are smaller. There's the green and the blue. I think there are other colors, but the blue is smaller than the green. So these are things you need. So you've taken your alcohol wipe, you've taken your tourniquet, you've taken this butterfly needle or any other type of needle to take your blood. Then you look at the cannula for cannula. So sorry, the butterfly is for the collection. I'm sorry. So we are talking about IV cannulation. So your alcohol wipes, your tourniquet, your cannula. Then what else? Your gloves, your tape, your gauze in case if you miss the sample, if you miss the procedure, and then your tegaderm for the IV cannulation. I didn't put the tegaderm is on the screen, the hand. I didn't get the actual picture, but that's the tegaderm on that hand. So that's for IV cannulation. So once you've collected all the sample, you go to the patient's bay and the bedside, agree the patient, identify, cross-check the IDs just to make sure it's the same thing you have with the ID you have prior to going to gather your equipment. So once you've come to the patient bedside, identify the patient's identity, and then explain what you're about to do. Introduce yourself. I'm doctor. I've come to put some the cannula for IV fluids or blood. Explain what the procedure you're about to do, and then get the patient's consent to carry on, and then explain what you're going to do, the steps you're going to, just in a short summary, just explain what you're about to do to the patient and gain the consent. And once you've done that, then you carry on with your cannulation. Select the vein, clean, insert, confirm if there's any flashback, flush. Yeah, you need your flush as well. Sorry, I forgot that. And then secure with the tegaderm. That's for IV cannulation. Then for blood collection, that's when you need the butterfly needle, the sample bottle, depending on the type of blood you're collecting, the full blood count or the UNEs and everything. Like in my trust, when you've printed the blood, the request form, it tells you the color of the bottle you need to take as you're going. So sometimes it's not good, but it's good to know this color coding just for exam purpose. But most times during the actual practice, they tell you everything is there. Sometimes you don't need to cram it. So that's the same thing. You go to the patient's bedside, identify the patient, cross-check the identity, explain your procedure, obtain consent, and then carry on with the procedure. That's the collection. Depending on whatever blood you're collecting, it's still the same step. Apply the tourniquet, palpate the vein, clean, insert, take your sample. release the tourniquet, dispose of sharps, and then label, do a good labeling, and then send to the lab. Most times they use the pod system, a machine that just directly sends the sample to the lab. That's for that. Then for the ABG, we know the indications where we do ABG. So ABG is most times the commonest indication here in NHS. The commonest thing is when the patient is in respiratory distress or patients that have had seizure. The seizure is mostly the VBGs, but the ABGs are mostly in respiratory scenarios. That's when you do that. So the same steps, but here you don't need the tourniquet. It's just the wipes, the needle, which I've just displayed here. They are different. These are another type. There's also another type, but all these things are labeled. If you go to the treatment room, they're all labeled. They label where it is, so you look at it and confirm that you've got the ABG needle with you. Then you see the same steps. When you see the same confirming identity, try to make sure that it's the same patient that you have as well. The patient you want to do the procedure on. So take your consent. After taking your consent, explain the procedure, and then go carry on with the ABG. Most times we go for the radial artery. That's the commonest site we do here. And then what else? The catheterization is the same procedure or the same steps of taking your consents and explaining the procedure, and then carry on with what you're about to do. Explain the thing to the patient, and then carry on with the procedure. The urinary catheterization, like I mentioned, it comes in a sterile pack. The pack is sterile. So, and then you go, it has it's just something similar to what I've shown on this picture, on the slide. And the pack has the bag, URI bag, then your water for inflation, water for the lubricating gel, the water for inflation, and then I think it also has sterile water for cleaning. I think, yeah. And then it has gauze, and also it has some sterile gloves as well. So remember, in your urinary catheterization, you have to wear your PPE and everything. Same applies to the other procedures as well. Yeah, but why I mentioned in catheterization is very important for splash and the rest. So aseptic prep, insert the lubricant. When you've done all the steps of taking consent and explaining what you're about to do and to the patient, then then remember to wash hand before the procedure. And once you've cleaned, you open your sterile pack, clean again, and then wear your gloves, and then carry on with the procedure of cleaning the area, inserting the lubricants, inflating the balloon, and then look out for the flush back of urine. So that's that for catheterization. Then for the NG tube, it's the same steps of explaining, making sure that you've identified this patient in terms of, I keep mentioning this identity because there's how the word gets busy that you might mistake it. It's common things to mistake patient for a patient. It's very, very common. But it gets very bad when you've done it on the wrong patient, especially invasive, not really invasive, but sorts of procedures like this NG2. So it's very, very important to make sure you've identified the patient's identity. Are you sure it's this patient, or the name of the patient and date of birth? Yeah, confirm their name, confirm their date of birth. Yeah, their full name and their date of birth and address. That's the commonest identity. 3 things you ask. Then you carry on with the procedure. NG tube, like measuring from the nose, the ear, the xiphostenum, then lubricating the tip of the NG tube, and then insert the NG tube, ask the patient to swallow as you're going in, and the rest. Yeah, and then make sure if you try to aspirate on different positions, if you don't get it, like sitting forward, leaning back, after aspiration, if you don't get anything and the patient is talking but no, then you send the patient to X-ray just to confirm that the NG tube is in or no. If it's most times, if the NG tube are inserted for feeding. Yeah. Another thing also that is similar to this NG tube is also rice tube, but those ones are This one, the rice tube is just for decompression. It's a bigger form of tube. It's bigger than the feeding tube, the NG feeding tube. The rice tube is just to decompress in the conjection in for bowel preparation in terms of small obstructions and the rest. Yeah. But I think the NG tube is commoner than the rice. The rice tube are done, but it's common in surgery. Yeah. Apart from these ones as F2, another one that that is common is the lumbar puncture. But that one, like I mentioned, you make sure you need to sign your competence. You need to go for training. Make sure you, like in my church, we do training for lumbar punctures, which you register for the training, go for the training course where you practicalize this on mannequins and then get to do it with someone supervising you. The step, observe it, get to do it with someone, and that's how you get on with it. Yeah. Lumbar puncture is another one.